Here is a coiling exercise which engages and activates the pulling and extension muscles of the back, and also the external rotators of the shoulder. These muscles are collectively part of the urinary bladder and small intestine channels in Chinese medicine. These channels are activated by fully stretching the muscles of the posterior shoulder girdle and back, and then engaging these muscles from their stretched positions. The foundation exercise starts with the feet forward and with the body in a slight lean back. To initiate the movement, turn the elbows to the side, which rotates the shoulder joint. Follow this into shoulder protraction, and then let the entire spine flex, stretching the muscles and fascia of the back. Then turn the elbows down, which initiates the contraction of the posterior shoulder girdle, back, glutes, and even legs. You can also use resistance bands or gymnastics rings for this exercise, which makes it slightly more engaging for the channels. But the goal of this stage of the exercise is not necessarily to overload the muscles, but to activate and focus the movement. The bands or rings simply make it more dynamic and allow for more movement. After activating these muscles, I like to transition into a front lever progression. Here I am working on a front lever with the assistance of resistance bands. To set up this progression, hook the straps between the thumb and the first finger and place the straps at the low back and upper thigh. While resting on the resistance band and with the feet still on the ground, you can return to the coiling exercise as a way to prepare for the full move. Since you have spent time with preparation, your body should be primed to better transition to the front lever. After training the front lever, I like to return to the basic coiling exercise, but with the use of gymnastics rings and with a more horizontal body position. I start with the coiling, but then transition to holding and trying to remove as much of the weight off my feet as possible. My goal is to slowly pull myself into the full front lever.